Good morning, everyone. My name is Radwa. I did my PowerPoint presentation on syphilis. So let's get started. So for our agenda today, we will meet our patient. We will talk about their signs and symptoms, their physical findings, their diagnosis, and their treatment plan. So let's meet our patient. TJ is a 31-year-old male who presents to an outpatient clinic with a chief complaint of, I think I'm allergic to something. He states he was in his usual state of health about 2 days ago, and he began developing this rash on his stomach that is now on the palms of his hands and soles of his feet. The rash is not painful or itchy. Upon further evaluation, he states that he had the strange little pimple-like thing on his penis a couple of weeks ago, but it went away all on its own, and it never really hurt. He is sexually active with 2 to 3 concurrent male partners. He has had unprotected sex with at least 2 of his partners in the past couple of weeks. He had participated in condomless intercourse and has been in a monogamous relationship during the past 6 months. He doesn't know his sexual history of his current or past sexual partners and admits to at least 15 lifetime partners from what he can remember. He doesn't ever recall being tested for HIV. He received all of his childhood vaccines, but he has never been vaccinated against HPV and is unsure if he ever had received hepatitis A vaccine. For allergies, he denies any allergies to food, medications, or environmental. He has no past medical history. His mother passed away at age of 52 from stroke. His father is still living and has type 2 diabetes. He denies any past surgical history, denies being on any medications. For his social history, he tested positive for ATOH, positive for marijuana, negative for tobacco, and no illicit drugs. For his physical exam, his vitals are as follows. He has a temp of 101.3. His blood pressure is 140/87. Heart rate is 71. Respiratory rate is 18. He is currently sitting at 98% on room air. He's 5'7" tall and 59.5 kilograms. His general appearance. He is in no apparent distress. He's awake, alert, and oriented ×4, but is noted to be slightly underweight. For a clinical presentation, his physical examination revealed a diffused mohawk continuous rash noted on the patient's abdomen, back, and upper extremities, which includes the palms of his hands as well as the soles of his feet. Maculars are easy to blanch and are not associated with any area of fluctuance. There is no alopecia, there is no neurological deficits or ocular or cardiovascular abnormalities that are noted at this time. So we diagnose syphilis based on how the lesions are. So they normally look red, raised, scaly lesions, based also on the lab testing and the clinical presentations and how the symptoms progress is how we would diagnose syphilis. So for the diagnostic studies, as we all know, syphilis is a dangerous STI. Dark field microscopy is the most specific technique for diagnosing syphilis when an active Chers or condylomia limb is present. For differential diagnosis, that's when we're first not sure what the patient has and we have a hunch that it might be syphilis. We would do a complete hemogram as well as ESR. We'll do the liver function test. We'll do a renal function test. We'll do random blood sugar as well as the vitamin B12 level, serum HIV, radiography of the brain and the spine, nerve conduction velocity, and electromyography. We'll do serum VDRL and rapid plasma vision test. We're going to do the TPHA test, which can detect any antibodies that are specific for syphilis. The Cerebrospinal fluid analysis will also be done. And once our patient has been diagnosed and the diagnosis of syphilis has been confirmed, the healthcare practitioners are required by law to report the disease to the Department of Health. For the treatments, when diagnosed and treated in its early stages, syphilis is easy to cure. It's effectively treated with penicillin. It is the preferred treatment at all stages of syphilis. After you have been treated for syphilis, one will have periodic blood tests and exams to make sure that the patient is responding to the usual dose of penicillin. And as key notes, for patients who are tested positive for syphilis, they should avoid all sexual contact with new partners until the treatment is completed and a blood test indicate that the infection has been cured. One should also notify their sex partners so that they also can be tested and get treatment if necessary. And they should also get HIV tested. Those are my references. Thank you so much for listening. I hope you enjoyed my presentation. Thank you so much.